tonight, I return to speak to all of you about an issue that is central to that future, and that is the issue of health care. If you misrepresent what's in this plan, we will call you out. These are the facts. Nobody disputes them. Everyone understands the extraordinary hardships that are placed on the uninsured, who live every day just one accident or illness away from bankruptcy. These are not primarily people on welfare. These are middle-class Americans. Some can't get insurance on the job. Others are self-employed and can't afford it, since buying insurance on your own costs you 3 times as much as the coverage you get from your employer. There are now more than 30 million American citizens who cannot get coverage. In just a 2-year period, 1 in every 3 Americans goes without health care coverage at some point. And every day, 14,000 Americans lose their coverage. More and more Americans pay their premiums only to discover that their insurance company has dropped their coverage when they get sick or won't pay the full cost of care. It happens every day. One man from Illinois lost his coverage in the middle of chemotherapy because his insurer found that he hadn't reported gallstones that he didn't even know about. They delayed his treatment, and he died because of it. Another woman from Texas was about to get a double mastectomy when her insurance company canceled her policy because she forgot to declare a case of acne. By the time she had her insurance reinstated, her breast cancer had more than doubled in size. Then there's the problem of rising cost. We spend 1.5 times more per person on health care than any other country, but we aren't any healthier for it. It's why so many employers, especially small businesses, are forcing their employees to pay more for insurance or are dropping their coverage entirely. And it's why those of us with health insurance are also paying a hidden and growing tax for those without it, about $1,000 per year, that pays for somebody else's emergency room and charitable care. Let me repeat this. Nothing in our plan requires you to change what you have. And insurance companies will be required to cover, with no extra charge, routine checkups and preventive care, like mammograms and colonoscopies, because there's no reason we shouldn't be catching diseases like breast cancer and colon cancer before they get worse. That makes sense, it saves money, and it saves lives. If you lose your job, or you change your job, you'll be able to get coverage. If you strike out on your own and start a small business, you'll be able to get coverage. We'll do this by creating a new insurance exchange, a marketplace where individuals and small businesses will be able to shop for health insurance at competitive prices. This exchange will take effect in 4 years, which will give us time to do it right. Even if we provide these affordable options, there may be those, especially the young and the healthy, who still want to take the risk and go without coverage. The problem is such irresponsible behavior costs all the rest of us money. And that's why under my plan, individuals will be required to carry basic health insurance. I believe a broad consensus exists for the aspects of the plan I just outlined, and a requirement that people who can afford insurance get insurance.
And we've had an ongoing discussion about health care. Both of us want to provide health care to all Americans. She mandates that everybody buy health care. She'd have the government force every individual to buy insurance. And I don't have such a mandate because I don't think the problem is that people don't want health insurance. It's that they can't afford it. So I focus more on lowering costs. And this is a modest difference, but it's one that she's tried to elevate, arguing that because I don't force people to buy health care that I'm not insuring everybody. Well, if things were that easy, I could mandate everybody buy a house, and and that would solve the problem of homelessness. It doesn't.
I realize that many Americans have grown nervous about reform. So tonight I want to address some of the key controversies that are still out there. There are also those who claim that our reform efforts would ensure illegal immigrants. This, too, is false. The reforms I'm proposing would not apply to those who are here illegally. And one more misunderstanding I want to clear up. Under our plan, no federal dollars will be used to fund abortions, and federal conscience laws will remain in place. My guiding principle is, and always has been, that consumers do better when there's choice and competition. That's how the market works. Without competition, the price of insurance goes up and quality goes down. Unfortunately, in 34 states, 75% of the insurance market is controlled by 5 or fewer companies. In Alabama, almost 90% is controlled by just one company. The public insurance option would have to be self-sufficient and rely on the premiums it collects. But by avoiding some of the overhead that gets eaten up at private companies by profits, and excessive administrative costs, and executive salaries, it could provide a good deal for consumers. It would also keep pressure on private insurers to keep their policies affordable and treat their customers better, the same way public colleges and universities provide additional choice and competition to students without in any way inhibiting a vibrant system of private colleges and universities. And I will make sure that no government bureaucrat or insurance company bureaucrat gets between you and the care that you need. Finally, let me discuss an issue that is a great concern to me, to members of this chamber, and to the public. And that's how we pay for this plan. Now, here's what you need to know. Add it all up, and the plan I'm proposing will cost around $900 billion over 10 years. Second, we've estimated that most of this plan can be paid for by finding savings within the existing healthcare system. Reducing the waste and inefficiency in Medicare and Medicaid will pay for most of this plan. In fact, I want to speak directly to seniors for a moment. That is why not a dollar of the Medicare Trust Fund will be used to pay for this plan. The plan will not add to our deficit. The middle class will realize greater security, not higher taxes. I will not sign a plan that adds one dime to our deficits, either now or in the future. And to prove that I'm serious, there will be a provision in this plan that requires us to come forward with more spending cuts if the savings we promised don't materialize.